Hi, I'm Dr. Annabel D. Herrera. Welcome to part 4 of my series on endometriosis. What are the signs and symptoms and red flags of this condition? I would like to highlight that each individual's experience is different, and you don't need to have all the symptoms that I will mention to have endometriosis. That said, the most common symptom is pelvic or lower abdominal pain that is found typically between your belly button and your hip, that lower part of the abdomen where you find the female reproductive organs. Now, pelvic pain or pelvic cramps may be often experienced before or during menstrual periods, or may even extend after the menstrual period. There are some women who may experience chronic pelvic pain that happens normally outside the normal menstrual cycle. In all cases, pelvic pain experience typically goes beyond the normal cramps, and it is described as intense, stabbing, churning, and even debilitating associated with dysmenorrhea. Dysmenorrhea is pain radiating to the lower back, now associated with discomfort in the stomach and pelvic areas. Why do we have the discomfort? It is due to the pelvic inflammation that occurs when menstrual blood, instead of flowing out of the body, now flows back into the uterus and is found in areas where they do not belong, internally and externally. So, aside from the pelvic pain, some women may experience discomfort and pain during urination or having a bowel movement. Why? Again, that menstrual blood finds its way in areas where they do not belong, like the surrounding tissues outside the pelvis, like the intestines, at the back of the uterus, or the urinary bladder in front of the uterus. And so during menses, these areas become sensitive. That's why women who have these endometriotic implants in these locations usually have painful defecation or painful bowel movements or painful urination. Aside from pelvic pain, we must remember that really bad pelvic pain at any time of the menstrual cycle, at any given time, is something that must be discussed with your healthcare provider, as it is not normal and should not be unattended, ignored, and just tolerated. There is absolutely no room to suffer in silence and become unproductive, impacting the quality of your daily life. Another possible sign and symptom of endometriosis is abnormal uterine bleeding. What does this mean? The normal duration of a woman's menses is typically anywhere from 5 to 7 days, and for visual representation, the normal amount of menstrual blood that typically leaves the woman's body during menses is about 6 to 8 tablespoonfuls of blood, or 80 cc. Women with endometriosis and present with abnormal uterine bleeding usually have excessive, heavy menstrual flow, consuming more than the usual sanitary pads used per menstrual cycle, associated with discomfort and dysmenorrhea. Women also with abnormal uterine bleeding may present as prolonged menses, meaning more than the normal duration of menses, and presenting as vaginal spotting or random bleeding between menstrual cycles. These symptoms are usually seen in women who suffer from adenomyosis or internal endometriosis. Additionally, other relative symptoms are nausea, bloatedness during a woman's menses. There's usually pain during sexual intercourse, and occasionally feeling of fatigue and less energized. Still, others with no symptoms will only discover that they have endometriosis when they can't conceive, get pregnant, or with infertility issues. Studies show that 50% of women who experience infertility have endometriosis. With endometriosis, there's a lot of inflammation and scarring that may affect the ovaries and the fallopian tubes, which makes it more difficult for the sperm and the egg to unite or for an embryo to implant in the uterus in a woman's body. So, to conclude this series on signs and symptoms, remember that endometriosis symptoms do not necessarily happen overnight and they can worsen over time if not treated sooner. The symptoms may be better for a time with pregnancy, and pain may become milder with menopause. Also, remember that the intensity of the pain is not related to the extent of the endometriosis growth in your body. Sometimes a woman can have very little amount of endometriotic implants, but she experiences severe pain. On the other hand, a woman with a lot of endometriotic implants can experience little or no pain at all. So it is important to see your doctor if you think you have any of the symptoms of endometriosis. In this way, you have better control of your experience sooner rather than later. Thanks for watching, and please stay tuned for my next video where I will talk about the causes of endometriosis.